I chose this topic because honestly, I've not seen anything discussed about this, on social media. And I really felt that because I'm kind of in a situation where I can share letters that I've written for medical students and graduates, I felt this would be a good talk. And I'm going to share with you three real letters of recommendation. We'll go through each letter, we'll look at each paragraph, and we'll start with this one. This is the first letter. This was, of course, written by me. You can see it's on the department letterhead. My name's there and so forth. So there are 6 paragraphs that you can clearly see. And the last part is very important. She has waived her right to view this letter. And that's key because, we'll talk more about it. It just allows for a very honest, very frank letter of recommendation. So this is a letter that I wrote. I'm writing this letter in support of so-and-so application for your internal medicine program. So you're seeing I'm specifying the specialty. As inpatient nephrology attending, I got the opportunity to supervise her and 2-week rotation in this and this. So it's always nice to set the stage by telling the program director what was the kind of affiliation or association between the letter writer and the student. In what professional capacity does the letter writer know the student? So that's why I kind of like to start my letter with this paragraph. She expressed a huge interest in learning internal medicine nephrology, interacted multiple occasions with my team of residents and students, very pleasant in her mannerism, respectful of her colleagues, allowing her to easily gel with the team members. I found her to be courteous to the patients, very good bedside manners, passionate about learning internal medicine, and attended so clinic that she requested to learn more about the program and to interact with nurses and patients. So you can see that the choice of the words that I used, huge interest, very pleasant, very good bedside manners, she requested. So these are strong words that are used in a letter of recommendation, really, that really goes a long way in supporting their application. Let's look at some more. In the 3rd paragraph, I wrote, she has very good communication skills, presents clinical information in an accurate way that she's ready to start residency training, good foundation of knowledge, great interest to learn internal medicine, and asking questions about topics like GN, hyponatremia, IV fluids. Now, this is the most important paragraph of this letter, and once we read, we'll understand why. While she was on our service, encountered a patient with very interesting findings on urine microscopy that she discovered. She observed numerous cysts in a patient. She browsed. She contacted the hospital and lab. Let me pull this down a little bit. Hospital lab to use this and demonstrated and confirmed so and so. I'm sorry, I have to black out all these details because for confidentiality reasons. She researched the literature and found rare reports of increased this with this that interestingly was being administered to our patient. You can see the exclamation mark here. Again, showing the enthusiasm, my enthusiasm for her application. Increased so confirmed our hypothesis. She took the initiative to do a PowerPoint, images, and literature. The faculty members were in awe, and they greatly appreciated the new information that they learned. She has prepared an abstract and has submitted this for presentation at so and so. So you can see that this is a very unique paragraph in this letter. I mean, this could have happened only in this rotation. And again, the choice of the words. She discovered, she observed, she browsed, she contacted, researched, she took the initiative, she prepared. So these are all, again, very strong words. And this is something called show, don't tell. So she is showing her enthusiasm for internal medicine and nephrology by all the actions that she took in this rotation. So that's what makes this letter very strong and very unique. And that's what, every letter writer should attempt to do when writing a letter of support. I have no hesitation in wholeheartedly recommending so-and-so to your program. Her ethic to work hard, excel in her medical career, along with camaraderie, great enthusiasm, make her a great asset to your program. Please do not hesitate to contact me if I can offer further information. So summarizing it nicely, wholeheartedly, great asset, again, strong words that were used. And so, of course, she got into residency, and I'm happy to say is considering nephrology as a career. So this was a wonderful, wonderful letter of support. Let's look at a letter that I wrote for an international medical graduate. Okay, so again, you'll see the 6 paragraphs. All letter writers have a certain template that they create based on, the letters they read, the letters they've written in the past. And so you'll see some similarities between the first letter and this. And again, the last part is very important. Waived her right to view this letter. Okay. All right. So I'm writing this letter in strong support of so-and-so application for internal medicine program. Had her medical school training at so-and-so, after which she took USMLE steps, scored very high on these tests. So that's exactly what I was trying to say. She had a very strong foundation because, she scored so high on these tests. She completed 3 clerkships in subspecialties at the renowned so-and-so. And I can say this is a very notable achievement for an IMG and shows her dedication to succeed because she was able to pursue these clerkships in the US. Being an international medical graduate, she has a very good exposure to US medical training and healthcare system. They'll give her a head start over her international colleagues starting residency training. So already, a very strong foundation for the rest of the letter. Okay, she expressed a huge interest in learning nephrology and applied to her division for observership. I've interacted with her on multiple occasions, and so. She's very pleasant, respectful of her colleagues, allowing her to easily gel with the team members, quickly learned the EMR, which is so important for an IMG, and interacted with patients. Again, trying to use strong words, huge interest, quickly learn, those kind of things. But there's some more. She has very good communication skills with no difficulty in understanding her accent, which I felt is important for a program director to know about an IMG. She presents clinical information, accurate, succinct way. She has a strong foundation, shows great interest to learn internal medicine, intelligent questions during rounds and conferences. I gave her an assignment to talk about bloodstream infections, and she presented the topic very well. So you can see I'm trying to personalize the letter again to what my interaction with her was during that time. Our rotation incorporates outpatient exposure to this, and so this doctor, she grabbed every opportunity to grow and learn as a physician. She attended our monthly journal club that we organized after hours. And the last paragraph summarizing it was that I have no hesitation in wholeheartedly recommending to your residency program. She makes a great asset to your program. So again, you'll see using strong words and trying to personalize the letter to what her experience was during that clinical experience. Finally, I'm going to share a letter that I got many years ago when I started applying for residency. So I'm writing to enthusiastically support the application of Dr. Varun Agrawal to your residency program. I supervised him and volunteered and observed in our clinic. So you can see just like how I wrote my letter that, start with have a strong start and tell how you're associated with this residency applicant. So he writes, Dr. Agrawal is professional, inquisitive, highly motivated, bright, conscientious, hardworking, learns quickly, and completed this and this, clinical research ranging from planning to implementation, did some literature search, taken the initiative to learn. So you can again see that he's trying to use these words to show the action that I took during the rotation. So like he learns quickly, he took the initiative to learn, and his presentations are complete and organized. And then it's very interesting because he now says an example. So he's trying to personalize this letter for me. Thoroughness can be seen in investigation of a searchable electronic library in which to organize our critical data and publications. He searched and assessed the software, networking, reasonable choices to house our slides, and so forth. And basically, whatever I did is kind of in that paragraph. And then he helped us administer questionnaires on this. He'll be a co-author on several abstracts to be submitted and instrumental and so on. So excels in every area. So again, showing the action that I took and using strong words, excels in every area. Now, this is a very interesting paragraph that he wrote. He's become an integral part of our research team, most reliable, best problem solver of the numerous volunteers who have worked with us. Remember, I told you there were other IMGs also at that time who were all working in this division. For the time I've worked with him, I give my strongest possible recommendation for a position in your program. So this was a letter that was given to me. So you can see the common theme of these letters of recommendation are that superlatives are used, very strong words, my highest recommendation, strongest recommendation, very good communication skills, and so forth. And that really shows, again, that you have a very strong, they really want to support your application for residency by using these superlatives. Now, another common theme of these letters of recommendation is that it's very personalized with anecdotes and specialty interest. Remember the anecdotes that I shared in my first letter. And this is how, the program director reading that letter knows that this is a very genuine letter, very honest letter, rather than a very superficial letter that doesn't, help much. So, it also shows when letter writers are using these anecdotes, these examples, the letter writer really wants to show how much they are rooting for you to win and get into residency. So that's why it's very nice to have this included in your letter of recommendation. Now, the other thing is that the letter, the residency applicants had waived their right to see the letter. Always choose this option. Because when you say that you have waived your right to see the letter, and when the program director knows about this, the program directors are assured that whatever is included in the letter is genuine, it's frank, it's honest, and no one was pressured to write things in that letter. When a residency applicant is making a request to a letter writer, this is the information that gets passed on, just like it was passed on to me. This residency applicant requested a letter for internal medicine, and they specified that they waived the right to see the letter. And so it's kind of nice to always choose that you waive your right to view the contents of the letter. Okay, next question is, whom should you ask the letter from? Who should be the letter writer? The first point is the best letter writers are the attendings who know you best, whom you've worked with and who know you very well. Not a nurse practitioner, not a resident, not a chief resident or a fellow. For a smart and hardworking doctor like you need letters from practicing doctors, from attendings who can attest that you have the skills and strengths to succeed in residency. So always go for the attending and no one else. Now, the other thing is, sometimes some residency applicants, you might work with like an assistant professor or an associate professor, but they want the letter from the division chief because, of course, the division chief is much more renowned, much more known, throughout the country than an assistant prof or a teaching attending or a practicing clinician. For residency, I don't believe it matters. For residency purposes, it's more important that the letter writer is writing strongly about you. Their academic rank doesn't matter. That kind of matters more in fellowship when you're applying, but that's not why we're talking about here. But sometimes you might get a lukewarm letter from the division chief. In fact, that's what happened with me when I remember the letters I showed you. So the letter that I got, the one that I shared with you, was the one that I submitted to ERAS, because when I also did request a letter from the division chief, and that was written much more superficially. The strong words were much rare, were not there. And he could not give me those anecdotes, just like what I shared with you in today's letter. So that's why resist the temptation of a lukewarm letter from Dr. Big Shot, like the division chief, department chair, and so forth. Also, I would say communicate with them extensively during and after US clinical experience, in person and email, because you want to make sure that the person who's going to be writing the letter for you knows you well, and you have communicated with them during the US clinical experience. Now, there's another reason for that, is because some of the teaching attendings sometimes have two different emails. Like, for example, I have a hospital email because I work in the hospital, and I have a university email because I also teach. But what happens is you're not going to know which one are they commonly using. And so when you communicate with them, you send them articles, you send them questions and emails. When you communicate with them, you'll know exactly how you can reach out to them in the future. If you have to, you'll know which email address to write them to. So that's another reason to be communicating with them extensively during the US clinical experience, and after. We'll talk about that also. All right, now let's go to when to ask for a letter of recommendation. First option, of course, is to request the letter right after the rotation or right after the observership externship is completed, because everything is fresh in the mind of the attending. Now, this gets tricky if, say, you're applying in September, 2023, and your rotation was, like, say, in December 2022. So the question then is, should you ask for the letter then in December 2022, or should you wait all the way until, say, June of 2023, when ERAS opens, to be asking for a letter of support? So I found this and in the ECFMG website, and where it seems that ERAS, you can purchase an ERAS token and upload the letter. So even if you were applying in December 2022, from what I'm reading, it seems that you can purchase the ERAS token and then upload the letter. What's not very clear to me, does it mean that you have to purchase an ERAS token in 2022 as well as 2023? I think that's what it's implying. But let's see what Dr. Danish might have to add to this about the timing of getting the letter.
Oh, thank you so much. That's a very interesting question, actually. So what happens is that you buy an ERAS token, and it is only valid for 1 year. So let's say you have done a rotation in 2021, but you're applying in 2022. So you get a token for 2022, and then you ask your letter writer so that they can update the date on their letter of recommendation. So, for example, they will say that this person rotated with me from January 2021 till February 2021. And everything is going to be the same, but the date on the signature is going to be the latest one, because I do know that some programs, they ask that the letters should be within the last 6 months, signed within the last 6 months. So that's how we go about it, I think.
Exactly. I mean, that's certainly preferable, though. When we read the contents of the letter, if it's going to still say, okay, I know this person from a month's rotation in 2021, for example, then having a more updated letter, I'm not sure. It looks much more recent, much more fresh, but the experience happened when it happened. That you cannot change that. So,
yeah, it's
but I think
not advisable to.
Yeah,
sorry,
exactly.
it's not advisable to lie about the dates or anything. I think it's only fair that you just ask them to refresh the date on your letter.
Fantastic. Yeah. So that's why so that's one option. Another option is, of course, after ERAS opens in June, and that's what Dr. Danish was saying. This would be probably a good time to reach out to those letter writers and say, hey, I'm applying. Could you please update that letter?
Yeah, so let's say that your ERAS application opens up in June, and you have to submit. The application submission starts from early September, and the end date is probably the end of September. So a good time to reach out to people is actually, in my opinion, is the start of June. So if you have done rotations before that, then you should just reach them out and say, hey, I'm going to apply this year, and my application closes in September. So I'm just reaching out to you early so that you have enough time to write a good letter for me. So the earlier you reach your attending, the better for you. We just don't want to pressurize anyone.
Absolutely. The next is like where. So do your best to meet with them in person. What I suggest is this. So if you have like say a 4-week, US clinical experience, meet with this attending of yours at the beginning, the first day or so. Introduce yourself to them. Be bold. Be upfront with them that you're applying for residency. Don't ask for a letter on day one, but at least ask them what are the expectations of the rotation, what are the rules, and so forth. Make yourself approachable and available to the attending. In the middle of the rotation, so if it's a 4-week rotation, somewhere in the end of 2 weeks, ask them for feedback. Could I please meet with you for 5 to 10 minutes for mid-rotation feedback? What time works best for you? That would be a very nice approach. So when you approach your attending in the middle of the rotation, just say, I want to meet with you 5 to 10 minutes. And, just ask, what do I do next for the next 2 weeks? And absolutely do your very best, work super hard to fix any problems that were identified with you in this mid-rotation feedback. And the end of the rotation, that's when you kind of thank them for the month, thank them for teaching you, for talking with you, interacting with you, and that's the perfect time to ask for a letter of recommendation. Now, I'm not sure there are many different approaches. This approach I feel works very well. If absolutely nothing works out, then you can also email a request for a letter of recommendation, but don't take the easy way out. Try to connect with your attending and show them that you're very passionate about learning and wanting to do your best, in that rotation. So how do you request a letter of support or letter of recommendation? You have to request for a strong letter of support. So you have to use this kind of language. Really, I would greatly appreciate it if you could write me a strong letter of support for my residency application. And another approach was, do you know me well enough to write me a strong letter of support? So these are some ways of approaching the attending and asking them for a strong letter of support. All the attendings, all the teaching attendings, they know why you're using this word strong. It's a way for us to back out if we don't feel that we can write you a strong letter of support. So use this word strong when requesting a letter of recommendation. For example, let's look at this letter that I'd received. This is from a medical student who rotated with me. He did let me know that he was going to apply for internal medicine, and so he writes this. Hope this note finds you well. Thanks for teaching. I'm reaching out because the residency application is now open, and I'm able to send you a prompt to upload. Would you still be willing to write a strong letter of recommendation on my behalf? I'm attaching this, happy to supply personal statement. So this is a very nice, very kind of standard way of asking for a letter of support. Another way, and this is something that I would propose that you do when you're asking your teaching attendings for a letter. Dear Dr. This, thank you for the wonderful opportunity. I really enjoyed learning from you, from the residents, from the fellows and the patients. As I briefly mentioned, I'm applying for internal medicine and would greatly appreciate a strong letter of recommendation in support of my residency application. Please find attached my CV and a list of my accomplishments, and you will be getting a separate email. And please upload the letter by this and let me know if you have any questions. So when you're requesting this letter, definitely send your CV. And I'm going to talk something about this list of accomplishments because I really feel that this makes our job so much easier. You're going to get a much stronger letter. You're going to get a much higher quality letter, and you're going to get it much faster also if you send your list of accomplishments with this letter, which is something like this. So when you're requesting a letter, you can submit this list of your achievements. data of observership, daily rounding with you and this resident here, and so. I presented a literature review of metolazone during rounds, presented European guidelines in case conference, discussed rationale for calcium gluconate, ABG analysis, observed native kidney biopsy, observed discussion, identified a case report, working with resident to write the abstract, observed urine microscopy, attended internal medicine morning reports, attended interdisciplinary teaching, met with the nurse to review hemodialysis, attended morning rounds, discussed pathophysiology. So yes, a lot of it's like day-to-day work, but if you present this to your to the letter writer, this will give them a lot of good stuff to then include in their letter of recommendation. So besides sending the CV, I highly suggest you send them this list of accomplishments, and it will really make our jobs and our lives much, much easier. So I really hope this recommendation works out for you guys. Okay, to send reminder in 4 weeks. If you're starting sometime in June, I think 4 weeks is 3 to 4 weeks is a good time to send a gentle reminder. I think that's perfectly fine. No problem with that. And that works. Now, another question was how many letters of support to be getting. So this is where we have to look at the ERAS instructions. ERAS allows you to upload as many letters as you want. You can have like 20 letters in your ERAS application. But ERAS allows you to assign a max of 4 letters to each program. Okay? And programs, a lot of programs that I see require 3 letters to process your application. So my suggestion always is aim higher. So aim for 4 or more letters. And this way you'll make sure that you have at least those basic, the bare minimum of 3 letters for each program. The letter writers, your attendings are also human. They might have to take time off, I don't know, for an emergency, for family leave, or maybe they're changed jobs, they're no longer working there. So you will have these unpredictable situations. So that's why I always suggest aim higher, try to take more letters, and then choose, which letters are going to go when you submit your application to ERAS. Another strategy I would suggest is don't forget to include your photo when you're communicating with these attendings, either on your email signature. There are some very nice ways of doing that nowadays. And certainly in your CV, make sure you put your photo so that it allows that teaching attendant to recall, having worked with you. What do you do after you get the letter of recommendation, after they've uploaded it? Thank them profusely. Send them a card, send them chocolates if you want to. That's all good. Keep them posted. So, be in touch with them, every few weeks. Talk to them about maybe an interesting paper that you read pertaining to that specialty of the teaching attending. Follow them on social media. Keep it professional and, be in communication with them. And this is because they've worked so much with you. They're helping you out, supporting your application. The least you could do is, is be in touch with them and appreciate their efforts. Sometimes you might have the situation where the program director might contact the teaching attending. So you don't want to be in a situation where they just cannot recall you. And having this open line of communication helps them remember you if they're approached by a program director. Definitely share your match result with your letter writers, even if it's not a positive match result, but keep them posted, and they might even be able to help you out prepare for the next residency application. So please keep them posted. So some letters that I've got, like the first letter is from that first letter that we saw. Thank you for your help and guidance. Phenomenal teacher, clinician, enjoyed working with you. I matched here. Your letter of recommendation was valuable to me, and I'm very excited about that. And this is that second letter that I wrote for the IMG. Hope everything is fine. It's a great pleasure that I matched this year, and this is where she matched. Good interview season, and thank you for the encouragement. So, I want to thank you again for that wonderful rotation. So they're really thanking the letter writer and sharing their match results. So this is very highly recommended. As we come to the end of this talk, I want to, tell you another few things, which is why is letter of recommendation so important? For you, the simplest way to know this is no letters means no interview. So take the maximum use of all the learning opportunities in that rotation and communicating with the teaching attending. Really convey your passion for succeeding in that specialty, to the teaching attending, and that's how you'll get a strong letter of recommendation. I do want to also tell you that you are not imposing on your attending by asking for a letter of recommendation. Sometimes we may be hesitant to approach a letter writer, a teaching attending, asking for a letter that that we may be causing them more work. But clearly, among all teaching attendings, it's all well known. It's our professional responsibility to help out, residency applicants, medical students, and graduates by helping them support with these letters of recommendation. So never ever feel that you're burdening them. It's kind of it's something we have to do, and that's why sending them the CV and the list of accomplishments is really going to make their work much easier. Now let's talk about some special situations, and then I'll open it up to Q&A. Declining to write the letter. There was an IMG whom I worked with, and I had to decline writing them a letter. Maybe this was the first rotation for her, and maybe she was in a shock about the whole work culture. And she would address me as sir and the nurses as sister, and had a very difficult time communicating and even presenting the patients or talking about the patients at rounds. It was very clear that she was very unprepared. So even within the first week, I kind of explained to her that this is how she needs to be presenting and interacting. The cultural differences. I was trying to help her out with that, but still, she really didn't make a whole lot of changes over the next 4 weeks. And so when she asked me for a letter, I had to tell her that I'm sorry, it's not going to be a strong letter, and I feel when I truthfully write about you, it's going to hurt your application. So, but thankfully, she took that feedback, and I'm pretty sure she made the changes when she then did her subsequent rotations and so forth. But that's again a reason to kind of aim for more than 4 or more letters, is in the rare instance that someone is declining to write you a letter of support. Now, what if you apply to 2 specialties, say internal medicine and family medicine? That's where it gets a bit tricky. Either you could have a single letter and not specify the specialty, kind of like one of the letters I showed you, or you can have them write 2 different letters, one for internal medicine, one for family medicine. I think the first option would be better, that they just don't mention your specialty. Fortunately, internal medicine and family medicine are so similar in terms of the skills and the communication skills needed. It's not much different, so that letter is going to work for either specialty. But that's these are the only 2 ways around the fact if you're applying to 2 specialties, and brings back the point that I highly encourage you to choose just 1 specialty when you're applying for residency as best as you can. All right, draft a letter and send to me. So this is a question that I get asked many times. And what would happen is I get this request from some residency applicants asking me if I could review a letter of recommendation that they're going to then have it signed by that attending. And I would have to decline doing that review because it's not going to be personalized enough if I just review a letter that has to be written by someone else. So this situation where you did the rotation, you did your observership and so forth, and you approach the letter writer for a letter, if you get the response, write the letter and then send it to me and I'll sign it. First of all, it's a red flag. It just shows you that they are not super interested in helping you. So I would take that as a red flag. And then it becomes very tricky whether you really want to write a letter and have them sign it, or ask another attending, or just go on with the next rotation. That's why I suggested earlier, right? Besides the CV, send your list of accomplishments, because I feel that'll really give them the content to be put in the letter. It really makes our jobs much easier. If you do end up writing a letter for your letter writer, you're not waiving your right to see the letter. In fact, if you look in ERAS, if you don't, if you want to upload the letter by yourself, of course, you have seen the letter, and that piece of information will be sent to the program director. The program director will know that you uploaded the letter. And so be very careful of these kind of situations. It's a tough one, really, and it's very unfortunate, and I kind of feel bad for the residency applicant when I hear these kind of requests. Attending changes every week. Now, some of these rotations are created in a way that you have one attending on week 1, second attending on week 2, third attending week 3, and a fourth attending on the fourth week. So then you question, whom should I ask a letter? Because 1 week is a very short time to be writing a letter of support. So if this is the kind of rotation that you've been told is going to happen, I think it's nice to upfront figure out, maybe from the program coordinator or from the division chief, just wanted to clarify and ask whom I should be asking for a letter of support. Sometimes what happens is the division chief would then write the letter. They'll take the input from all the attendings and then put it in a letter of support. But that's the best you can do if it's structured in a way that you don't have an attending for more than 7 days, that you're working with. Research letter for a clinical field. Now, this is a situation where, some of the IMGs I've worked with, they have been doing working in a lab or working in research for 5, 6, 7 years. They have so many papers, but when they apply for residency, they question, should I get a letter from my research mentor? Because they're kind of wondering, how's a letter from a researcher going to help them in residency? I see it as a red flag if you have spent so much time, like a PhD or a master's program with so many publications, and you're not able to get a letter from your research mentor. Because then it might be that, okay, something terrible happened, or you're trying to hide something. So if you have a lot of research experience, have spent many years working with a mentor, I highly suggest one of the letters to be from that research mentor, who can talk to you more about, again, your communication skills, writing skills, getting work done, and working in a team, collaboration, presentation. And those skills are transferable. Those skills will apply to you, when you will help you even in residency. So don't kind of ignore your research mentors just because you're applying to a clinical specialty. And lastly, the future. What does the future look like? There are standardized letters of evaluation that's being studied. I believe some specialties have that already. I think in emergency medicine and obs-gynae, it seems like they have their letters of standardized letters of evaluation. So it's basically like a checklist or list of items that they need to fill out. Internal medicine, I'm starting to see these structured letters of evaluation. It's not mandatory yet for internal medicine, but what I'm trying to say is, down the line, this will be something that we might see more of, just to standardize all the letters, because sometimes we have to read between the lines when we get a letter of recommendation. So this kind of eliminates all that bias and uncertainty.
First of all, I would like to add a couple of points. That was an excellent coverage of the entire topic. I think no one has done a better job at this. So I want to talk a bit from the applicant from the applicant perspective. I think, as Dr. Varun Agrawal pointed out a lot of things, the things that you should keep in mind, that whenever you're doing the rotation, you guys should be punctual. You guys should be curious, show initiative, and ask them if you can present a case or present a case report, do some research work, any presentation. So these are all of the things which help your letter writer in writing you a good letter of recommendation, in my point.
Absolutely. So, and keep track of all those things that you're doing, like an ABG analysis, arterial blood gas. Yes, it's kind of almost implied that that's what you'll do, like in a critical care ICU rotation or a nephrology rotation. But if you keep track of it, that's what then you put in your list of accomplishments. You want to show that you did stuff. You just don't want to ask for a letter and not tell them what you did in that 2 or 4 weeks.
And one more thing, I can tell how are you going to upload the letters of recommendation, because I get that question a lot from a lot of students. So since it's going to be posted on YouTube, so I think that will make it more holistic.
Fantastic.
There you go. So whenever you request a letter of recommendation, I think the applicant's perspective is very important. So this is how your dashboard is going to look once you get your token. This is how your ERAS residency application dashboard is going to look. You will have your application details over here, your documents, and the programs, number of programs you've applied, and so on and so forth. Here you will have your AAMC ID. And so whenever you click on documents, there will be a section for the letters of recommendation. So let's say you click over here, you will be referred to this page, and I have included a couple of them, just like Dr. Varun Agrawal said that you need to have more. So let's say we click over here, add new. Then this is what my application looked like. I've obviously blurred out the names. So let's say we want to click add new. This is how the field is going to appear. Then let's say if you're going to fill it for Dr. Agrawal over here. So this is how the information is going to look like. Letter author name, Dr. Varun Agrawal, author title, Associate Professor of Medicine, Department Nephrology, and which specialty is this letter going to be assigned to. So this is a very important point that you have to specify before submission which specialties is going to be. So we have to specify, is it going to be internal medicine? Is it going to be neurology or anything else? If we scroll down further, then you will get some questions like, is this person the program director of your program or the department chair? You can select none of the above if they're not. And this is another important point that he highlighted very aptly, that you have to waive your right to see the letter, that it is showing that you don't know what the letter writer is going to write about you. And then if you click save, this is how it will appear. So mind you, very important thing over here that it will say not confirmed for upload. Over here, you will get two options. These are of edit and delete. So what to do next? You have to select this or check this box, and then you have to confirm the letter. So once you do that, the ERAS will ask you to submit your ERAS password. Once you do that, it will now show that the letter has been confirmed for upload. I'm just repeating these points because whenever anyone is trying to upload a letter, they get very confused. So once it is confirmed for upload, you cannot delete it. So very important point one is once it is confirmed for upload, you cannot delete it. However, what you can do is that you can deselect it or not assign it to the programs. So from here, you click on actions. So it will give you two options, download letter request or email letter request. So this is probably the best way to go about it. For example, I click over here, email letter request. So it will give me this pop-up. It will show Dr. Varun Agrawal, Associate Professor of Medicine, Nephrology. So I will type his email and, for example, email address, and then I'll just draft a brief message. Dear Dr. Agrawal, hope this email finds you well. I'm writing this for you to submit my letter of recommendation. Best regards. And then you can just preview it and double check things, double check the spelling mistakes, and then click send. So this is basically, in my point of view, what you can do for a submission of your letter of recommendation. So once this video is uploaded, this information will be very important for you guys.
Absolutely. One thing I'm going to say about when you're writing that letter, this for the residency applicants, be absolutely sure you're spelling the letter writer's name correctly. My name gets messed up so many times, and when I see that, I already get so upset that I just get so upset when people are not able to spell my name, even after it's like so easily available. So please don't make that mistake. Double check 3 times, 4 times, check the name of the letter writer, and just try to keep it as professional, and no grammatical errors, no spelling errors, and this way you'll do your best in requesting that letter of recommendation.